Before I attended the course, I couldn't walk, I couldn't go out. I was in a disability cart.
I would think that I was suffering with asthma very badly. I couldn't breathe, I couldn't talk.
I would get out of breath at the slow. I used to walk up Eltham High Street, but I had to stop every now and again.
I had very, very limited mobility and got out of breath at the slightest bit of exercise.
Pulmonary rehabilitation is a 7-week supervised exercise programme designed by Greenwich Community Health Services. It's for the people who live in the borough of Greenwich who have a chronic lung condition such as emphysema or chronic bronchitis. Patients who are becoming more and more breathless because of their condition will benefit from attending this course. The exercises are designed to help our patients cope with feelings of breathlessness and help improve strength and fitness levels. Evidence tells us that the impact of pulmonary rehab can be extremely significant. Patients have demonstrated not only improvements in their fitness levels, but also in their perception of breathlessness, in their quality of life, and a reduction in their levels of depression and anxiety.
When I was referred to the pulmonary rehab, I was very nervous, very apprehensive, didn't think it would do any good.
I must admit I was extremely frightened and approached it with some trepidation.
I was a bit apprehensive. I didn't know what it involved or what it is going to involve.
When patients first start the classes, they're taught how to do the exercises, and each week they're encouraged to do a little bit more. The session always begins with a warm-up and finishes with a cool-down and some stretches. The classes are sociable and enjoyable as there is the opportunity to meet other people who are in exactly the same situation.
Yeah, when I was referred to exercise, and I was just amazed to see what they did with me, and I benefited so much that I can't tell you.
They started giving me a sort of confidence how to handle myself and how to handle my daily-to-daily living.
Pulmonary rehab has taught me that exercise is good. People come here thinking they can't do this, they can't do that. They see the machines and they think, no, we can't do that at all. But then they realise they can, and they can go out and they can walk. And they're not going to fall down and collapse just because they get breathless.
The programme also involves education sessions delivered by a wide range of healthcare professionals. Patients benefit by learning more about their lung disease and ways to stay fit and healthy. The sessions include information on what is COPD, how to deal with a chest infection, respiratory medicines and inhalers, oxygen therapy, sputum clearance techniques, good nutrition, anxiety and depression, the importance of exercise, goal setting, and a COPD quiz.
Patients with chronic lung disease can suffer a lot, and the major issue is breathlessness, and this can be extremely distressing and disabling. The natural response is to avoid doing things that cause patients to become breathless, and gradually over time patients can become less and less active. Their bodies become deconditioned, less fit if you like. The key to this, however, is exercise, and that's what pulmonary rehab is all about. We do know that exercise can actually be better than some of the drug treatments that we offer. As healthcare professionals, we need to change our approach to patients with chronic lung disease and offer exercise as a treatment via access to a local pulmonary rehab programme.
Since I've done the course, leaps and bounds. I can walk, I can breathe. I know how to control my breathing when I'm getting an attack. I know how to psych myself up. I know how to breathe, bend down, bend over. It's so much, I've been so informative.
Oh, I feel much better. I can walk, I can climb the stairs quite comfortably. I can handle my, I can carry some suitcases. At the same time, I feel as if I'm sort of rejuvenated. I mean, it's brought strength into my body, you see.
The impact that's had on my quality of life has been immeasurable. My goal was to take my grandchildren to Greenwich Park again, because we used to go there a lot, but I haven't been able to before the exercise classes, and that was my aim, to take them back to Greenwich Park.
And you succeeded?
I succeeded.
But now, as I say, the confidence to go out has come back. I wasn't driving before I did pulmonary rehab, and I'm driving again now, and that's given me quite a bit of independence as well.
The best thing I did in my life is meeting my wife, and second best thing I did is I came to these classes and did my exercise routine for 7 weeks, and that helped me tremendously.
Once patients have completed the programme, they will have the opportunity to continue exercising in many different ways. The pulmonary rehabilitation team will provide support and encouragement for patients to ensure they continue to exercise. It is extremely important that exercise becomes part of a weekly routine to prevent the cycle of inactivity creeping back in. By choosing an exercise you enjoy, planning it into your week, involving your friends and family, you are more likely to succeed in staying fit and healthy. This will also help to maintain all the benefits achieved at pulmonary rehabilitation.
Pulmonary rehabilitation is run twice a week at the Waterfront Leisure Centre in Woolwich and in Eltham at the Eltham Centre. From time to time, we also run classes at the Arches Leisure Centre in Greenwich. If you live in Greenwich, have a chronic lung disease and are interested in attending the classes, please ask your GP or practice nurse for more information. It is important that you are assessed for the class to ensure you are safe to exercise. This assessment will be carried out by a member of the pulmonary rehab team once you have been referred.
And what would you say to somebody who is watching this that might be apprehensive about taking the course?
Oh no, please do take it. It's brilliant. It is really good. It's really, my life is so much better now. If you're thinking about it, don't stop thinking and do it.